Welcome back, everybody, to another deep dive. And today we're diving into some pretty murky waters.
Oh,
It's
yeah.
Medicare Advantage.
Yeah.
And the question everybody seems to be asking is it actually as cost-effective as it's supposed to be?
Right.
And we've got this Wall Street Journal article that's been making the rounds,
Mm-hmm.
causing quite a stir online, especially over on Reddit.
Definitely. Yeah.
So we're going to break it all down today.
Okay.
First, how does Medicare Advantage actually work?
Mm.
And is it really saving taxpayer dollars like it promised?
Right.
And of course, we've got to get into what the Redditors are saying.
Oh, yeah. They always had a lot to say.
Always insightful, sometimes a little spicy,
Yeah.
but always fun to see what people are thinking.
It's a hot topic for sure. And I think the way Medicare Advantage is structured, it really kind of gets to the heart of how healthcare is paid for in this country.
Okay, so for
Yeah.
those of us who haven't, sat down with the Medicare handbook and,
Right.
highlighted
Yeah.
every single line,
Yeah.
what's the difference between MA
Okay.
and just regular old Medicare?
So traditional Medicare, that's run directly by the government.
Okay,
But with Medicare Advantage, it's private insurance companies
Oh.
who are managing those benefits.
gotcha.
The thought was that, they could be more efficient, maybe save some money.
So the government's basically outsourcing to the private sector a huge chunk of Medicare,
Yeah, pretty much.
and it's become really popular.
Hugely. Over half of all Medicare beneficiaries are now on MA plans.
Wow.
Yeah.
So, but this Wall Street Journal article, they're kind of throwing a wrench in the works here.
Hmm.
They're saying that some of these insurers, they might be inflating diagnoses to get bigger payouts.
Yeah.
Did they actually find evidence that this is happening?
So they really dug deep into billions of Medicare records.
Wow.
And their analysis suggests that, insurers are adding diagnoses
Mm-hmm.
to patient records that aren't really there.
Wow.
And this has resulted in billions in extra payments from Medicare.
Billions, like with a B.
With a B. Uh-huh.
That's a lot of money.
It is. And the article mentions $50 billion over just 3 years.
That's the entire budget of some small countries.
I know. It's a lot.
This isn't just about money, though, right?
Right.
These are people's lives.
Exactly. Yeah. And the article highlights the case of Gloria Lee,
Okay.
who was diagnosed with a diabetic complication after a home visit from a nurse representing her MA plan.
Okay.
But the thing is, she's never even had diabetes.
Oh, wow. That's scary.
It is. It is.
Makes you wonder how many other people are being misdiagnosed just to line these insurance company pockets.
Right? Makes you think,
So how are they getting away with this?
what?
I mean, there has to be some kind of oversight, right?
There is oversight.
Okay.
But the problem's kind of baked into how Medicare reimburses insurers.
Mm-hmm.
It's designed to pay more for sicker patients.
Okay.
It's called risk adjustment.
Okay.
And it's meant to account for those higher costs of caring for people with, more complex health conditions. Right.
Yeah.
But it also creates this huge incentive for insurers to find as many diagnoses as possible,
Okay.
even if they're not completely legitimate.
So this risk adjustment thing, it's meant to be fair, but it sounds like it's kind of backfiring.
Yeah, that's the big question here.
The sicker they make their patients appear on
Mhm.
paper,
Uh-huh.
the more money they get.
Yeah,
Is that what we're saying here?
pretty much, yeah. And the article even goes into some of the tactics that they're using.
Like what?
So they're doing home visits with financial incentives for patients who participate.
Okay.
They're really scrutinizing those patient charts, looking for anything
Wow.
that they can use to add a diagnosis.
Huh.
And some are even using AI algorithms to mine data and flag potential diagnoses.
So they're really going all in on this strategy.
Yeah, they are.
The article mentioned an ophthalmologist, Dr. Howard Chen,
Right.
who gets paid by these insurers to give them access to his patient charts.
Yep.
But he says he's not seeing nearly as many cases of diabetic cataracts as the insurers are diagnosing.
Yeah.
That's a pretty big red flag.
Absolutely. That kind of discrepancy really makes you think, are they genuinely trying to provide better care?
Yeah.
Or are they just, padding their bottom line?
It's a little disturbing.
Yeah, it's a disturbing thought.
So, and this isn't like some obscure medical journal article.
Right.
This is the Wall Street Journal.
Hmm.
And it's causing a lot of outrage online, especially on Reddit.
Yeah, Reddit's blowing up about it.
Yeah,
The reactions are pretty wild,
I bet.
People are angry, they're calling for reform, some are even making, kind of dark jokes about it.
Yeah.
It really seems to have struck a nerve.
Yeah, I can imagine.
Mhm.
It sounds like this is really hitting a nerve with people.
Yeah, for sure.
What are some of the things folks are saying over on Reddit?
It's a real mix of emotions,
Okay.
Some people are just outraged. at the thought of this kind of potential fraud happening in Medicare, especially since, it's supposed to be there to help seniors.
Right.
And others are just demanding stricter regulations,
Yeah.
protect both patients and taxpayers.
Right.
It's a lot of anger, a lot of concern.
I bet there are some pretty colorful comments in those threads.
Oh, yeah.
Anything that really stands out to you?
Yeah, there was one I thought was pretty insightful.
Okay.
Someone pointed out the irony of, private insurers being seen as more efficient,
Right.
when
Yeah.
this whole situation kind of suggests they might be manipulating the system for profit.
It does make you think.
Yeah.
If this is really happening on a large scale,
Mm-hmm.
it kind of undermines the whole argument for privatizing these public services.
Yeah, exactly.
What else? What else is out there?
There's this other comment
Yeah.
comparing, the consequences of someone stealing a loaf of bread
Okay.
to these companies potentially making billions from Medicare fraud.
Oh.
And it really highlighted the perceived imbalance
Right.
in how we treat, different types of offenses.
It's a really good point.
Yeah.
Makes you wonder, why aren't we hearing more about this from our elected officials?
Yeah.
The article mentioned the recent killing of the United Health CEO, but there hasn't really been a whole lot of talk about reforms
Right.
in the aftermath of that.
Yeah, it's interesting, right?
It's very interesting.
It's a complex situation, for sure.
Yeah.
It's possible that politicians are hesitant to take on powerful industry players,
Right.
especially, in an election year.
Right.
But the lack of public discussion is definitely concerning.
For sure.
Mm-hmm.
Okay, so we've heard about the potential downsides of Medicare Advantage.
Right.
Obviously, a lot of public outcry it's generating.
Yeah.
But the insurance companies, they're not just sitting back and taking this, right?
No, they are pushing back.
What are they saying?
They're arguing that they're actually improving care coordination and catching diagnoses that doctors might miss,
Okay.
which they claim leads to better outcomes for patients in the long run.
So they're saying they're actually adding value to the system,
Exactly.
not just exploiting it.
That's what they're saying.
Okay.
For example, United Health claims their data shows higher treatment rates
Okay.
than the Wall Street Journal's analysis suggests.
Gotcha.
So basically saying that they're providing more comprehensive care,
Right.
and that's why their diagnoses might appear higher.
Okay, but the Wall Street Journal, they're standing by their reporting, right?
They are, yeah.
Yeah.
They've defended their methodology and their findings,
Okay.
saying they've carefully reviewed the data and believe their analysis accurately reflects the potential for inflated diagnoses in the Medicare Advantage system.
So we have a bit of a he said, she said going on here.
Yeah, a little bit.
The Wall Street Journal's raising some serious concerns.
Mm-hmm.
Insurers are defending their practices.
Yeah.
Public's caught in the middle.
Yeah. It's
Yeah.
a tough one.
So what happens now? Is anyone trying to actually fix this system?
Well, the Centers for Medicare and Medicaid Services,
Okay.
CMS,
Okay.
is trying to tweak the payment system.
Okay, in what way?
So they're planning to reduce payments for some diagnoses
Okay.
and add others to the list that warrant extra reimbursements.
So they're trying to make the risk adjustment formula more accurate.
Yeah, trying to fine-tune it.
Do we know if that's going to work?
It's hard to say. It's too early.
Okay.
Some experts are skeptical that these adjustments will be enough
Okay.
to address the root of the problem,
Right.
which is this fundamental incentive for insurers to overdiagnose.
Right.
They argue that more systemic changes are needed.
So tweaking the payment system might be a good first step,
Mm-hmm.
but it might not be enough to fix the whole problem.
Yeah.
What other solutions are people talking about?
Well, some are suggesting that we need more transparency
Okay.
and accountability.
More oversight.
Potentially, yeah.
Okay.
Some are calling for independent audits of diagnoses to ensure their accuracy. Others are suggesting making the data on diagnoses and payments more publicly available,
Gotcha.
so researchers and watchdogs can really scrutinize it.
Transparency, the best disinfectant.
Exactly.
So more transparency might help deter bad behavior and also identify those areas where the system needs to be improved.
That's the idea.
Okay.
But even with those measures,
Yeah.
some experts believe that the fundamental structure of Medicare Advantage needs to be rethought.
Yeah.
They argue that having private insurers manage a public health care program just creates inherent conflicts of interest.
It does make you wonder if the goal is to provide the best care for seniors.
Mm-hmm.
Is this current system the best way to do it?
That's the million-dollar question.
It is.
Maybe there's a better model out there.
Yeah.
Some folks have suggested exploring a hybrid system that
yeah.
combines the strengths of traditional Medicare and Medicare Advantage.
Okay, so something that allows for more government oversight
Right.
and regulation while still leveraging that innovation and efficiency
Exactly.
of the private sector.
That could be one approach.
Okay.
It's a complex issue.
Yeah.
There's no easy answers.
It seems like it.
But I think the first step is just acknowledging that the current system has some serious flaws that need to be addressed.
For sure. So it really feels like we're kind of at a crossroads.
Yeah.
With Medicare Advantage, we see these potential benefits.
Right.
But also, some pretty alarming problems. For a listener who's just tuning into this whole thing,
Right.
what would you say are the key takeaways from this deep dive?
Well, I think the biggest takeaway is that, the way Medicare Advantage is structured, particularly its reliance on this risk adjustment, it creates a real tension between profit and patient care.
Yeah.
It really seems like the system is set up to incentivize these insurers to make patients appear sicker on paper than they actually are.
And the consequences of that are huge.
Huge.
We're talking billions of taxpayer dollars
Yeah.
potentially being spent on treatments that are unnecessary
Right.
or even harmful.
Uh-huh.
And then not to mention the impact on individual patients who, might be misdiagnosed or subjected to these procedures they don't actually need.
Absolutely. Yeah. And I think the Reddit reactions we talked about really highlight how much this resonates with people.
Yeah.
There's a sense that the system isn't really working the way it should.
Right.
And something needs to change.
It's clear that this is, a really complicated issue.
Yeah.
No easy solutions.
Right.
We've talked about tweaking the payment system, increasing transparency, maybe even exploring some alternative models like that hybrid system. What do you think is the most promising way forward?
Honestly, I think it's going to take a combination of approaches.
Okay.
We need to reform the payment system to reduce the incentives for overdiagnosing. But we also need to increase that transparency and accountability.
Right.
Make sure that these insurers are actually acting in the best interest of their patients.
And ultimately, I think this is a conversation that needs to involve, everybody, policymakers, healthcare providers, the insurers, and most importantly, the patients.
Exactly.
We need to be asking these tough questions.
Yeah.
About, what kind of healthcare system we actually want and how do we ensure that it's providing high quality, affordable care for everyone.
Yeah, absolutely. This deep dive is really just a starting point.
Right.
And I really encourage our listener to keep digging into this, explore those different perspectives, read the Wall Street Journal article, check out those Reddit threads, see what resonates with you.
And don't stop there.
Right.
Talk to your friends, your family, your doctor.
Exactly.
Share what you've learned.
Keep that conversation going.
Keep the conversation going. The future of healthcare depends on an informed and engaged public.
Well said. And, as we wrap up.
Yeah. I want to leave our listener with one final thought.
Okay.
We talked a lot about the financial implications.
Yeah, billions of dollars.
Billions of dollars, exactly.
At stake.
But at its core, this is about people. It's about ensuring that everyone has access to the care they need when they need it.
Right.
Without that fear of being exploited or misdiagnosed.
Right. It's a powerful reminder that healthcare, it's not just a business.
Right.
It's a human right.
Yeah.
And it's up to all of us to fight for a system that puts patients first.
Well said.
Thanks for joining us for this deep dive.
Yes, thank you.
See you next time.
See you later.